So I'm Paula Jackson-Jones. I'm the president and co-founder of Midcoast Lyme Disease Support and Education. We are the Maine partner of the National Lyme Disease Association. We're members of the Maine CDC Vector-Borne Work Group, and we're active in Lyme legislation. I am also a survivor of late-stage neurological Lyme. I was misdiagnosed by 23 doctors and specialists. I have a story very similar to many of yours. I went down the MS path. At age 34, I was diagnosed with Parkinson's. And when my arms and legs stopped working and I was choking when I would swallow, they were contemplating sending me down for testing for ALS. That was the day I threw my last fit in my primary care doctor's office. I demanded to see someone who knew something about Lyme disease. My sister-in-law, Carol, had been whispering in my shoulder for many years. You need to get tested. I had 4 negative Lyme tests. What happened that day in the primary care doctor's office, they said, we cannot give you a referral to a Lyme-literate provider because that is not what we think you have. So he graciously ripped off a piece of paper, wrote a lady's name down and a phone number and said, call her, she knows a thing or two about Lyme disease. That was Dr. Sarah Ackerley. She's not on the panel tonight, but she saved my life. She and Leon Heck, many of you have heard his name, he's a Lyme-literate provider down in Portsmouth. They together ran tests and discovered I had late-stage neurological Lyme that was complicated by Babesia, Bartonella, Rocky Mountain spotted fever, and ehrlichiosis. So 4.5 years of treatment. I'm now 5 years in full, complete remission. And in 2014, along with Angel Rice, many of you know her name from social media, we co-founded the Midcoast Lyme Disease Support and Education Group. We've grown to a free statewide resource. We do a lot of support measures. We do a lot of financial assistance programs for people. So if your insurance is not covering something or you don't have insurance, we are networked with financial institutions. We are also networked with over 250 Lyme-literate providers here in the state of Maine. How many of you knew there was 250 Lyme-literate providers in the state of Maine? So whether you're looking for somebody up in Blue Hill or Caribou or down in Scarborough or Portland or anywhere, we've got names of people that understand how this disease presents. They know how to diagnose it, but more importantly, they know how to treat it. So, and we offer all of those services free of charge. So I'm happy to be here moderating. I'm happy to see some of my old friends again, and I hope you guys enjoy this evening.
Great, yeah, good. So mine's going to be quite a bit shorter than that. I don't have that much to say, really. So I got my start in Lyme disease in naturopathic medical school. Jacob Aguiar, sorry. Jacob Aguiar, naturopathic doctor, Scarborough, Maine, co-founder of Scarborough Integrative Health, which, you know, we're close to 100% Lyme focused or other chronic infectious diseases, as well as PANS, PANDAS, which are neuropsychiatric issues that affect children. So this is what we do day in, day out, fully immersed in it. But I got my start in studying Lyme disease in naturopathic medical school. 3rd year, I started taking conferences with Dietrich Klinghardt, started shadowing some Lyme-literate doctors in Seattle, which is where my naturopathic medical school was. And so as I was preparing for graduation, trying to figure out where I would end up, North Coast, where Leon Heck and Christy Fassler and Jennifer Quinn practice, they had a job posting. So I called them up. I had actually precepted with them a year prior, so they knew who I was. We got along really well. So they offered me a job, so I got my start in a pretty well-established Lyme-focused clinic. And I was there for about 3.5 years, and almost 2 years ago, we opened the clinic. Jill Mahoney and I, who's a Lyme-literate medical doctor, opened our clinic down in Scarborough. So that's where we are today.
Hi, my name's Annette Mueller. I'm a family nurse practitioner. I co-own a functional medicine specialty practice in Scarborough with my husband, Rudy Mueller. But we have, I would say 75% of our patients have Lyme or some co-infection. I started learning about this when Rudy, my husband, who's not here to even talk about it, he presented with pretty much what looked like early onset Alzheimer's, and he was 27. We just got married, and his brain was just mush. And Sunny Raleigh, who was here at the time, put on this Lyme conference, right, in Falmouth, and she's showing a picture, people are showing pictures of this bullseye rash on the back of the knee that was very nasty looking, and Rudy's like, that's what happened to me last year. And so we really started putting all the pieces together and had to dive in to really treat him and learn all these other integrative ways of approaching it. So I went to iLads and trained all with them, but constantly are looking for more integrative approaches as well, which iLads seems to be doing more of now, which is great. So yeah, we treat it a lot. We're recognizing it, we're treating it successfully. People come to us not knowing that they have Lyme often, and then that ends up being what it is. And yeah, that's my story.
Good evening, my name is Shawn McCoy. I am the Medical Director of Integrative Health Center of Maine. We are on Auburn Street in kind of outer Portland, just before Falmouth. And I'm a medical doctor. I'm board certified in family medicine as well as holistic and integrative medicine. And my journey into the world of Lyme disease and tick-borne disease was a little atypical. I graduated from medical school and residency not really knowing a whole lot about Lyme, the standard stuff that most doctors know, and opened up my practice and started doing functional medicine and integrative medicine. And people started walking through my door with all these really strange symptoms and maladies that I couldn't really explain with the standard medical diagnoses that I was taught. So I had to learn on the fly, and started going to conferences and reading books and talking to the experts, and learned more and more and more, and realized the more I knew, the less I knew. And so it's kind of been a continuing journey in that direction. I do functional medicine, I do primary care, I do family medicine. I certainly see a lot of tick-borne disease and a lot of complex patients, and I can certainly say that treating Lyme and the tick-borne diseases is easily the single most intellectually challenging issues that have come up in my practice. It's so complicated and so interesting and so rewarding to see very sick people who have been ill for years and years finally get better. I love doing it, and it's really hard and wonderful at the same time. So I'm really happy to be here, and thank you all for finding parking places.
So we've got a list of some generic questions.
Can I ask questions?
Oh, we're going to ask some questions up front first, and then after we ask the questions, and if we haven't addressed any of your questions, then we'll take them from the audience. So, Shawn, do you want to start by telling everybody what Lyme disease is?
Sure. Lyme disease is an infectious disease. It's caused by a bacteria that's a spiral-shaped bacteria, or a spirochete called Borrelia. There are various subclasses of Borrelia. It's been around for at least 5,000 years. The first documented case of Lyme disease was Ötzi the Iceman, found in Austria or Italy or something like that, and he had Lyme disease in his knee. He was treating himself with acupuncture for that, which is interesting. So it was discovered by Willy Burgdorferi back in the early 80s, when all of these children in Lyme, Connecticut were showing up with juvenile rheumatoid arthritis in this kind of cluster of cases in one neighborhood. And so he was the one that discovered this little bug crawling around with those kids, and named it Borrelia burgdorferi. And so Lyme disease presents in different ways. It typically starts as a flu-like illness, so people feel kind of crappy. They might have some fever, some chills, just feeling a little flu-ish. They might get some joint pain or some muscle aches or pains, and those symptoms typically present the first few days or weeks of the infection. Some people will get a rash, and some people will get a bullseye-shaped or target-shaped rash, although that is less than half of people who get Lyme disease. As the little bug learns how to live in your body and escape from your own immune system, it becomes more and more of a systemic head-to-toe, body-wide problem. And so the symptoms begin to progress to neurological symptoms, often described as brain fog or cognitive difficulties or attention trouble, memory loss. It can spread to your heart and cause a pericarditis or palpitations or arrhythmias or heart blocks. It can spread to every single cell in your body. They have found Lyme disease in people's teeth. And so the longer it has a chance to kind of do its thing in your body, the worse and worse the problem can become. Not everybody who gets bit by a tick will get Lyme disease, and not everybody who gets Lyme disease will get this chronic issue, but it can be a problem like that.
Annette, do you want to address some of the other tick-borne diseases that people have presented with?
So the most common ones that I think of are Babesia and Bartonella primarily, also anaplasmosis and ehrlichiosis, I would say, are the top. Babesia is a parasitic infection, also transmitted by ticks. Bartonella is a bacterial infection. And then anaplasmosis and ehrlichiosis are two other common ones. There's several others, but those are probably the top 4, I would say, that we see the most. Each requires a different treatment approach. There is some overlap with the Lyme treatment, but different antibiotics or different approaches for each infection. And there can be a lot of overlap with symptoms as well with Lyme, so that we're trying to tease out which co-infection is really presenting. Certainly we have the testing as well, but often there's some key symptoms that might be associated with one or the other sort of co-infections that help guide us in our treatment protocols.
Jacob, do you want to talk about somebody was bit by a tick, they become symptomatic, but they did not get the bullseye or any sort of rash, but they are symptomatic? What are the steps into looking into what other tick-borne diseases they might have? What are you looking for when they present?
Oh, looking for a lot. So as Annette mentioned, there's a variety of symptoms that can be associated with the different tick-borne illnesses. Anaplasma and Ehrlichia tend to present with a very high fever. So 103, 104, really high fever. A lot of people end up going to the ER, maybe get treated presumptively in the ER, because many of the lab tests early on will be negative. The immune system hasn't produced sufficient antibodies for a positive test, typically until about 3 to 4 weeks post infection. So in that initial critical acute phase, the clinical diagnosis is key. That's basically what you're working off of, is a clinical diagnosis. And so, acutely, the co-infections could present in their classic forms acutely, but it's kind of hard to pick up. Someone who has babesiosis may not necessarily have the shortness of breath or unexplained cough or the palpitations. They may, but it may not always present in the acute phase. I think what our standard approach is, if somebody has a tick bite, doesn't know if that tick transmitted Lyme, meaning they don't have the bullseye rash, we'll get them started on a treatment immediately. If it's an adult, usually doxycycline. If it's a kid under 10, Augmentin typically. There are other antibiotics that work, but those are kind of the standard go-tos initially. And then we keep a really close eye on people. Typically with people who have chronic Lyme or co-infections, we do 4-week follow-ups, but in the acute, maybe about 2 weeks, do a phone call, check in, how are things going, make sure they're asymptomatic. One of the challenges, though, when you do treat Lyme acutely, there's a really high likelihood the test, if you were to test later, it would come back negative because the immune system never produced the antibodies. So if you are symptomatic after an initial treatment, you're again basing it off of the clinical presentation. The doctor is not on an actual Lyme test. And unfortunately, I have a ton of patients that come in who even had a bullseye rash, and the doctor will do a Lyme test, an ELISA with a Western blot, and it's negative. It's like, oh, well, here's two doses of doxycycline. It's like, oh my God, it's terrible. And that's not even following sort of standard CDC protocol, unfortunately. So the doxycycline, if it's Lyme, usually that's where we start. I wouldn't necessarily, within the acute phase, put somebody on like rifampin, which treats Bartonella, or Malarone or Mepron, unless it was like crystal clear, because those are medications that have a number of side effects associated with them. They can, do some damage to the gut. I have used herbals in addition to an antibiotic. So maybe the doxycycline plus a broad spectrum herbal approach that would address co-infections, but not sort of heavy hitting like the antibiotics would. So you have that coverage, but don't have the downside or the side effects associated with them. Yeah. I don't know, was that the question? Did I answer the question? Okay.
You did.
All right.
And the next
Tough
one,
to know.
too, so that's
Okay.
good.
All right.
So as I had mentioned when I shared a little bit about myself, I had 4 negative Lyme tests. So I'm going to throw this one at you, Shawn. What complicates testing? Why would a patient have symptoms but still have a negative Lyme test?
Well, here's the problem with Lyme disease. The bug, the spirochete, didn't read the textbooks, so it doesn't really know how to present. So Lyme is a smart little bug. It knows how to hide from our immune system. We're discovering more and more every day how it actually does that. But with most infections, you get an infection, your immune system sees, there's a problem here, this is a bad guy, and your immune system goes to work and begins to make antibodies. These are little proteins, little bullets in the gun that fire after that virus or that bacteria and kill it and wipe it out and does its job. And so with Lyme disease, the same thing tries to happen. Your immune system tries to see this little spirochete and begin to kill it and fight it off. The problem is, Lyme is a smart little guy, and it knows how to transform itself. So it changes itself from a spiral-shaped bacteria into a little cocoon, call it a cystic form. There are other forms as well. And on that cocoon, that little bacteria no longer has the little neon sign saying, I am Lyme disease. So your immune system says, oh, no problem here. There's no neon sign. I don't need to make antibodies. So it stops fighting off that little bug, even though the bug is there in that cocoon dormant form, which can wake up weeks or months or years later. So the testing that we have for Lyme disease is often antibody-based testing. We're looking for those bullets, the little proteins. And in the first few weeks of an infection, we make an antibody called IgM, or immunoglobulin M. And after about 8 weeks of an infection, we make another antibody called IgG, or immunoglobulin G. And that often gives us a long-term immunity to something. If you had chickenpox when you were a kid, you still have IgG chickenpox nowadays. But with that Lyme, being a smart little guy, you may or may not make that IgM, may or may not make that IgG. And so the tests will often say, no Lyme here, the tests are negative, no antibodies, but the Lyme is actually present in that person's body. It's called a false negative test. The other thing that Lyme does is it makes other chemicals, other growth factors that actually suppress your body's ability to produce those antibodies. So it's turning off that immune response actively. Like I said, smart little bug. So the standard tests are often a false negative response. How often that false negative happens is very controversial in the medical literature. Some people say the tests are accurate about 80 or 90% of the time. Other medical literature suggests about 40 to 50% of the time. So flip of the coin. Depends on who you believe in terms of the literature. Certainly speaking from my own clinical experience, I have had plenty of patients who definitely had Lyme disease. They had the bullseye rash, the tick bite, they're sick, all of the symptoms are there, and yet the test is negative and negative and negative and negative months or even years later. So that happens, in my experience, more often than not. On the CDC's website, it says right on the front page, Lyme is, as Jacob mentioned, a clinical diagnosis. What we mean by that is if that person presents with all of the symptoms of Lyme disease and they tell a good story, I was bit by a tick, I had all these symptoms present a week later, and I feel terrible, they probably have Lyme disease unless you can explain those symptoms with other medical diagnoses. And it doesn't matter if the test is positive or negative. They have Lyme disease. It's a clinical diagnosis. It says so on the CDC's website. At the bottom of that page, it says the tests are nice for confirmation. So it's nice to make sure that they have Lyme disease with a positive test, but you don't need a positive test to treat that patient. And most doctors do not understand that concept, unfortunately. So that's the problem with the testing. This false negative rate is very high with Lyme disease. We're always looking for better and better methodology. There's a couple companies here tonight who have kind of cutting edge testing technology that have a much higher rate of likelihood to have a positive test. So in my own practice, it's nice to get that confirmation. It's nice to have a black and white objective piece of paper that says, yes, you have Lyme disease, and here it is on a piece of paper, so now we can definitely treat you. But that's not always the case. So for my own practice, I'll try the kind of standard testing first. If that's positive, yay, we have good answers. If we need a positive result for the insurance company to pay for antibiotics, then I'll turn to one of the private companies, a couple are here tonight, who have better tests than the local labs around here. Unfortunately, those tests are often not covered by insurance, so you got to pay out of pocket for them. So we have to kind of do the most cost-effective methodology that we can for testing. But the biggest point I want to drive home, if you fell asleep already, wake up for 30 seconds. The biggest point I want to say is Lyme disease, you do not need a positive test to treat for Lyme disease. It's a clinical diagnosis. So your doctor has to listen to you and understand that.
So one of the things my organization does when we travel around the state doing educational and prevention talks is we try to get people to think about ticks and tick-borne disease and not fixate so much on Lyme, because we get so caught up on the classic bullseye and whatnot that we we get that tunnel vision and we don't think about the other co-infections which are on the rise. So Annette, since you touched on some of the co-infections, what are some of the signs or symptoms that you're looking for in other people when they present and they say, I was bit by a tick, or I think I have Lyme disease? What are some of the other outward symptoms that are clearly not Lyme, that are an indicator of another or the presence of a co-infection?
So, like Jacob was mentioning, the really high fever at the onset is typical of anaplasma or ehrlichiosis. For Babesia, I'll often find this just severe anxiety, like off the charts anxiety. Their heart is racing at night, they can't sleep, they're having night sweats. Those are, and then shortness of breath for no reason, and this cough and intermittent fevers throughout the day, but mostly like nighttime sort of symptoms. Bartonella can have kind of some similar symptoms to Lyme as well, but maybe having some more cognitive or emotional symptoms, very strong emotional symptoms with anger and rage and still having joint pain and all of this stuff, but all of a sudden they're not themselves and having this new stuff. In our office we have this initial Lyme symptom questionnaire and co-infections, and kind of go through and try to tease them out through the questionnaire as we're going through, and certainly we'll use some testing if needed for confirmation.
Could I add a couple of things?
Yes, sir. Sure.
With Bartonella, we'll sometimes see stretch marks. We'll see little
Yeah.
purple streaks called striae, but in places that we don't typically see stretch marks. So you see them on the back of someone's leg or kind of in the middle of their back, and those are actually the little Bartonella bugs crawling through the skin and leaving this inflammatory purple violaceous line behind. Tender skin nodules are also common with Bartonella, little lumps under your skin that hurt to the touch in weird places. And then the sore soles of your feet is one of the signs of Bartonella as well. It could be plantar fasciitis, but something like plantar fasciitis that is caused by the Bartonella. And then the other thing is with kids, pediatric population, Lyme disease doesn't present the same way in my experience. It's more of a behavioral change. So if you've got a kid who all of a sudden, for no other reason, starts acting up in school or can't think well or their grades suddenly plummet, got to think about Lyme disease and other tick-borne diseases as well. They don't always have the joint pain, the muscle pain, the headaches, the flu symptoms. It's often more of a psychiatric or behavioral presentation in the pediatric population. Sorry to interject.
Oh, that's great, thank you.
So Jacob, we're always hearing about co-infections. And I know that there's some providers out there that don't believe in co-infections. They think that it's one thing or the other, or they think that the other symptoms are something else. How prevalent is it for a patient to present either up front with more than one or during the course of treatment for a co-infection to present itself?
How common?
That you're seeing in your practice?
I would say the vast majority of patients. I would say there are very few patients that come into my office that have clear-cut Lyme disease. We use doxycycline a month, they get better, they go on their way. Rarely does that happen, and it may be because we're not sort of the first line docs. People aren't typically seeing us early onset, so it's harder to treat these infections. I think Annette had mentioned it. I mean, the Babesia and Bartonella are the two most common co-infections that we'll treat concurrently with Lyme disease. Tick-borne relapsing fever is fairly common as well. There are different strains of the Borrelia bacteria. So Borrelia burgdorferi is Lyme. There's Borrelia miyamotoi and other strains of Borrelia that cause a similar illness to Lyme disease. The symptoms can be a little bit different with relapsing and remitting fevers, so fevers that kind of come and go. There aren't a lot of labs that test for that. IGeneX does. They have great tests for the tick-borne relapsing fever. But I would say Bartonella and Babesia are right at the top of the list. And what can be difficult sometimes, as Annette was saying, there's a lot of overlap with symptoms. If you were to create a Venn diagram, like the circles, and see the overlap, the vast majority of symptoms overlap with the infections, about 90% of the symptoms. So we're really looking for those unique symptoms to try to make the diagnoses for co-infections. As inaccurate as Lyme testing is, Babesia and Bartonella are even less accurate. So the clinical diagnosis is really critical. So the Babesia, Bartonella, I don't know.
So I know we've got 3 different type of medical providers up here. I want you guys to talk about treatment, how you treat Okay, let's assume that we've got somebody that's got Lyme or Lyme and a co-infection. How do you go about your different treatments, and what complicates treatments?
Let's see, what time is it now?
That's what I was gonna say. It's a 7 hour, 5-hour conversation.
Well, because most people think once you get connected to your Lyme provider, you start treatment, it's going to be smooth
Clear
sailing,
cut.
and it's usually full of bumps and
Yeah.
U-turns.
It's individualized. There's no
Yeah.
cookie cutter approach with Lyme disease. So for me, as we mentioned, you've got to assess what's going on, listen to the patient. That's really a very important thing. Oftentimes, Lyme has been often called the great mimicker because it affects every part of your body and can mimic so many other diseases and vice versa. So people often come in complaining of all these head-to-toe symptoms, and you can't just throw an antibiotic at that patient for a month and expect them to get better. You have to I think you have to take an integrative, holistic, body-wide, head-to-toe approach, and not only kill the infection, but help their body get better too. And it's so different from patient to patient what has been affected in their body. So I really use an integrative method where I'm looking at gastrointestinal health and inflammation and hormone imbalances and the actual tissue damage and neurological repair and mind-body connections and psychiatric manifestations and. I really appreciate the work of a brilliant Dr. Richard Horowitz, who will be speaking at Paula's conference next year. Is that public knowledge? It is now.
It is now.
Sorry, Paula. You said he was good first, so there we go. So Richard wrote a couple of great books. One is called Why Can't I Get Better? And the other one's called How Can I Get Better? In that book, in that set of books, he has this 16-point differential diagnosis map that is for both clinicians and patients, but it kind of maps out all the various symptoms and how to work it up and what to do about it. And the book is this thick and it's a lot to get through, but it really is an excellent treatise on what's going on and how do you treat Lyme disease, and it is not easy. So for me, it's a very individualized, customized approach. I don't have a one-size-fits-all approach, but like we were saying before, the fortunate thing, this is probably one of the take-home points, the fortunate thing about Lyme is it's easy to treat when you catch it early. So prevention, and recognizing those early symptoms is so critical for all of you to educate your family, your friends, and your healthcare practitioners, because they don't know. And you've got to be your own best advocate and really push hard for that early treatment, because it's pretty easy to treat when you catch it early. The immature spirochete, as it just enters your system, is pretty vulnerable to those antibiotics. But once that bug has had a chance to begin to go through its life cycle and turn into those other resistant or persister forms, much, much more difficult to eradicate.
What type of treatment options can people expect from your office? What's the different modalities that you guys offer?
Yeah, so at my office, we Integrative Health Center of Maine, we've got a number of different practitioners that have a lot of different tools in the toolbox. As a medical doctor, I certainly use antibiotics when I have to. That's going to be either oral antibiotics or intramuscular injections or sometimes even intravenous antibiotics. I like to use antibiotics for the shortest possible time that I can because there are side effects, and these are dangerous medications. We have to use them at very high doses sometimes, and sometimes we've got people on 4 or 5 antibiotics at the same time. So that's a problem for people's bodies sometimes. I will always support their body through that treatment. And once we're done with the antibiotics, kind of getting them off that plateau, we move on to more herbal and natural and other integrated protocols to help their bodies to repair. One of the big questions out there in Lyme disease research is, can you actually ever get rid of Lyme disease once you've had this systemic, more chronic Lyme disease scenario? No one knows the answer to that. It's looking more and more like, if you've had chronic Lyme, you'll probably always have some spirochetes or bacteria in your body kind of hiding out. So I often find it helpful to have this sort of maintenance regimen, pretty simple, but something on board to boost the immune system, to kind of be there to fight off those spirochetes when they wake up again. So that's a longer term treatment modality. Along with the antibiotics and the herbals, I've got IV nutrition that I do, so IV vitamins. I have another IV machine called a UVLRX machine, which involves different wavelengths of light that actually go right into the patient's IV catheter and treat their blood. So we're sterilizing their blood with different wavelengths of light, and they're doing a new Lyme disease trial with that. It's kind of interesting stuff. We're moving to a new center in Cumberland in July, and we're going to offer hyperbaric oxygen therapy with that new center, so there's good evidence behind that for healing Lyme disease. We've got mind-body workers and therapists and naturopaths and homeopaths and Reiki practitioners and all kinds of good stuff in our practice. So, like I said, not a one-size-fits-all approach, but we have a lot of tools in the toolbox. Annette?
Yeah. So we don't have as many integrative providers at our office as you do. It's just my husband and myself, and now we have a massage therapist on board as well. But we also will generally start with antibiotics and herbal agents targeted for the co-infections. Working on protecting the gut, so managing any potential SIBO, which is small intestinal bacterial overgrowth, a very common thing, side effect from antibiotics, managing yeast. We spend about an hour of our initial visit counseling our patients about how to improve their diet to help get their immune system functioning at an optimal level. Basically, we want to try to be as anti-inflammatory as possible with their diet, eliminating sugar and gluten and dairy, and it can be a longer list of that depending on how sensitive each patient is, and then also working on preventing any kind of autoimmune issues or addressing them if they're already kind of there. So Lyme is one of those things that can kind of kick off a whole host of problems in the system and really confuse the immune system. So it's not working well on one side to fight the infection, but on the other side, the autoimmune side is kicked up and the body's attacking itself. So we really want to try to balance and try to help our patients do as much as they can naturally through their nutrition to reduce their inflammation. And then we do use a lot of supplements, I will say that, for modulating inflammation and as well, but nutrition is really key for us.
Yeah, so they've both said a lot of what we also use. I will say, treating Lyme and co-infections is very, very complex, as everybody sort of alluded to, and we don't always nail it the first time. Some people don't necessarily do well on the first course of antibiotics. Either there's an intolerance to the treatment or they don't get significant improvement in their symptoms. So I think having providers who are really adept at using the full sort of spectrum of prescription antimicrobials, but also herbal antimicrobials, because it can take 2 or 3 tries, and Paula maybe could attest to this. If you're treated for 4 or 5 years, I mean, you did a lot. Yeah, and most patients do, especially if they come in with with chronic symptoms. They've been ill for a year plus. I mean, I tell people in the first visit, if you've had symptoms of these infections for over a year, you should expect that we're going to be working together for about a year. So I try to set that expectation up front, because sometimes people think once they have the diagnosis, like, oh, it's going to be great, I'll do a month, 2 months of treatment, and they'll be well. And I think people just really need to understand that this is a process. Once the infections are treated, the organ systems of the body have to heal, they have to repair. So we're using treatments along the way to do that, but sort of knocking the infections down as far as we can first is that first critical step. And then as Shawn said, we don't really know if we can clear the infections, but the idea is you knock them down enough so that the immune system takes over. And so supporting immune function is really critical. Within the next month or so, we're actually bringing on a new naturopathic doctor who did a residency in Lyme in Canada for 2 years. And Canada has this really unique licensing format where if the law doesn't say you can't do it, you can do it. So as a naturopath in Canada, he could do far more than MDs could do, which is really odd and bizarre to me, but that's the way it was. But he actually has done a lot of like intra-articular injections. So if somebody comes in with a massively swollen knee joint, potentially ozone injections into the knee, different types of actual treatments for joints themselves. He also uses something I'm not that familiar with, but frequency-specific microcurrent, which I actually don't fully understand it. He and I were just talking about it. And then LDA and LDI, low-dose antigen therapy and low-dose immunotherapy, which are using very, very diluted substances. So it can be infections like Lyme and co-infections. It could be strep. In the case I talked about PANS and PANDAS, which are neuropsychiatric disorders that affect kids after they've had infections with strep or other tick-borne illnesses. Viral infections are also very common with that. So actually being able to use very, very dilute substances to actually try to retrain the immune system, because as Annette said, with these infections, the concern is your immune system's not just fighting those infections, there's collateral damage, so there's damage to your own tissues, and so using different tools to try to calm that autoimmune part, that inflammatory piece. And from an herbal standpoint, there are so many different herbal options out there. The two that I've landed on most are Byron White formulas and Beyond Balance formulas. I find they both work fantastically well, better than just like going to a store and picking up cat's claw or teasel. They have this sort of a proprietary process that they don't share because they don't want it to get out, but it seems to make them a little bit more potent. So I can have somebody, and I do this a lot, where I'll start with antibiotics, get somebody to a really good place, and then transition over to herbals, and I could have somebody on 2 antibiotics, let's say for 3 months, they're doing really well, transition them over to herbals at 1 drop, so not a dropper full, a single drop of an herb, and they start to herx. They have a flaring of their symptoms because the herbs are treating with a completely different mechanism from the antibiotics. So it's almost like hitting the Lyme with something it's never recognized, it's never seen before, it doesn't recognize it. So I think a lot of times I use combined approaches. If I think Bartonella is primary, maybe I'll use antibiotics for Bartonella, but if I'm hearing other symptoms of Lyme and Babesia, possibly using herbals for those. So as Shawn said, it's incredibly complex, and it keeps us on our toes every single day. Yeah.
So one of the things we're hearing from doctors that are not knowledgeable about treating Lyme and tick-borne diseases, they like to put us all in the same box. They like us all to have the same treatment. They want to throw the same dosage at all of us and expect the same results. Shawn, do you want to talk about why patients react differently, why there is no one-size-fits-all?
Sure. So the allopathic model of care, which is what I was trained upon as a medical doctor, it's very simple. Basically, you sit down with the patient, they give you a whole bunch of what we call complaints or symptoms, and you have to, as a physician, take all those complaints and put them into a box and call that a diagnosis. And then you use a pharmaceutical to cover up all those symptoms, and that's how you be a doctor, right? So that's right. That's pretty much it.
That's it. Thank you for coming.
Yeah, right. I saw the writing on the wall in my third year of medical school about the limitations of that model of care. Certainly it worked for some things, and it's very powerful, and there's a role for pharmaceuticals. But now we are discovering that genetically we're all unique, and we all have different responses to those medications and different responses to our illnesses. And so if you look at the world of cancer care, that whole world of oncology is heading towards genetically directed treatments because every single cancer is different from every other cancer. So that's one of the reasons why it's such a unique issue here with Lyme disease. Not everybody who, like I said, not everybody who gets bit by tick is going to turn into this chronically ill individual. I think living in Maine is in this kind of red zone endemic area. We're all getting bit all the time by ticks, and we're probably getting exposed to Lyme disease a lot, but most of us have strong, vital, healthy immune systems, and we fight it off like any other bug. But if you are unfortunate enough to be born with the wrong genes, or you are having other health issues, or you have a lot of stress in your life, or your nutrition isn't great, or other factors are playing a role that are leading to less than ideal immune responses, that gives that smart little bug a chance to get in and start to do its thing. And so those are the people that eventually kind of spiral down and down and down and get these chronic long-term lasting illnesses that are so complicated. Probably also the reason why there's not a one-size-fits-all approach is because we are all so unique. I'm getting more and more fascinated by the role of the gut. So the microbiome, all the little organisms that live in our gut that talk to the rest of our body and vice versa. We have 10 times more bugs living in and on us than human cells, which is kind of neat. And now we're figuring out all the benefits that we're getting from these little bugs and all the harm these little bugs do for us. So that's probably playing a role as well in the Lyme disease and the immune response to Lyme disease. So a lot of what I do involves fixing the gut too.
Annette, you touched on the counseling that you do with patients, and you talked about the diets and stuff. Do you want to speak to some of those conversations that you have and why it's important to curb your sugar and alcohol usage while you're in treatment?
So what we counsel our patients about is that the Lyme, you like sugar, the Lyme likes sugar. Lyme will keep on keeping on in your system as long as it has a nice carbohydrate fuel source in there. So one way to try to naturally help yourself get over this faster is to move more towards definitely a lower carbohydrate diet, and definitely no refined sugar. And we'll often move towards more of a very high plant-based, high healthy fat, modified ketogenic diet for patients, depending on if they have a lot of brain fog type stuff going on. And then alcohol certainly can fuel that sugar thing. It also is definitely increasing risk for candida. And how it was explained to me at ILADS, I think, was that it also can increase heat shock proteins in the system, which basically cause more inflammation and make everything worse. So even 1 to 2 glasses of wine a night, which is very common. People come in, oh yeah, I'm doing all this, and that can really be keeping people from getting well. And it's tough conversations to have sometimes, but it's important. And we find that people who are the cleanest on their diet, they get better so much faster. It's really amazing.
Can you define sugar? Because we say sugar, but we don't mean sugar, right?
Well, we mean anything that's going to convert to a sugar, so a carbohydrate. That could even be as much as too much fruit sometimes for some people, but definitely anything that's processed probably has sugar in it as well. We have our patients go on a gluten-free, sometimes totally grain-free diet, so that's cutting out a lot of those refined carbohydrates there. But yeah, not just table sugar, or not just soda. All these other sources can be really keeping the Lyme active.
So it's not just the illness that's producing inflammation, it's what we eat, what we put into our body. So we could unintentionally be fueling the disease.
Correct.
Heard that many times.
One of my favorite resources for a good diet is a book called Recipes for Repair. Originally written for Lyme disease specifically, but it's a really good anti-inflammatory book in general, Recipes for Repair. Written by somebody from New Hampshire, I think, or Vermont.
Local.
That's a good resource.
Laura Piazza. Laura Gail Piazza.
Aren't they local, like a New England local?
Yep.
Yeah.
Yep.
She was a patient at North Coast.
Yep. They're down in New Hampshire. Recipe for Repair. It's by Gail and Laura Piazza. Laura was a Lyme patient. Her mom, Gail, is a nutritionist. And so in the course of Laura's recovery, they worked with their doctors and came up with a recipe book, and it's through different stages of your treatment. Most bookstores have them. I think we've got a couple copies to lend out as well.
It's a very practical guide because we hear dairy-free,
Piazza.
gluten-free, all this free,
Yeah.
but what do you actually do? What do I have for breakfast? How do I go shopping? What do I
Right.
buy? And it gives all these wonderful menus and how to cook this way. And it's a very how-to kind of friendly guide.
How do you spell the last name?
Piazza. Yep. Yep. So one of the things that most, and I'm just going to, for the sake of ease, say non-Lyme literate providers don't talk to their patients about is detoxing, and how important that is in the course of treatment. Would you like to touch on that,
Yes,
sir?
absolutely. Yeah. So, so the body detoxifies through a number of different organ systems. They're called emunctories. The primary emunctories are going to be through the skin, through the kidneys, so through urine, through the gastrointestinal tract. So, bowel movements. The liver is a critical organ for detoxifying the lymphatic system. And for the longest time, even up until I think a couple years ago, medical science didn't realize that the brain actually has a lymphatic system, but we now know during sleep, your brain actually shrinks by a bit, so you actually get lymphatic drainage from the brain during sleep. So, lifestyle factors, and being a naturopathic doctor, I mean, for us, it all starts with lifestyle. So working on somebody's sleep habits, addressing diet, as both Annette and Shawn have mentioned. I use the Recipes for Repair cookbook with pretty much every patient. I would love to get people on full ketogenic diets, but that's really hard to do. So I think a modified keto makes a lot of sense. So sleep, diet. I talk about exercise. Exercise is kind of a tough one because it has to be consistent with what somebody's body is capable of. I have plenty of patients who they start to feel a little bit better and they think, oh, I'm going to go for even maybe a mile walk, and then it sort of knocks them out for 2 or 3 days. So, but exercise is fantastic, getting the fresh air, sort of moving the lymphatics, improving circulation. If you can work up a little sweat, that's great as well. We do detox a lot through sweat. Gastrointestinal health, like I mentioned, there are specific, I use specific herbal approaches that encourage detoxification as well. Nutrimedics, which is part of the Cowden protocol, a different herbal approach. They have one that I like a lot called Berber Panella. And Panella, thank you. And Panella has Berber Panella, B-U-R, /Pinella, Pinella. And Berber Pinella works for sort of body-wide systemic detox, but also has an affinity for brain and nervous system detox, so it can help with some of the brain fog and cognitive symptoms that people have. With treatment, I don't know if we've talked much really about the Herxheimer reaction, but so the Herxheimer reaction is a temporary, often temporary worsening of symptoms when you start treating an infection. Often occurs about a week to 2 weeks in, but because people are so individual, I've had some people where they herx the first day of treatment. Some people don't herx at all, like those are the lucky people, where they can go on 2 antibiotics, 0 herx, they just start to feel better. But most people will have a bit of a dip in their symptoms, and that happens really for 2 reasons. One, the immune system kind of comes back on board. You take these bacteria that have been invading the immune system, sort of kill them off with an antibiotic or an herbal. You have antigens or proteins that are exposed to the immune system, so you actually get an elevated immune response. And some of the symptoms can be due to that, so people will have maybe an increase in flu-like symptoms. But it's also kind of overburdening the the detox pathways as well. So helping really open up detox, keeping the body more alkaline or less acidic helps. So lemon water helps with that. Alka-Seltzer Gold. Certain binders, so things that will bind up inflammatory molecules in the GI tract. So things like activated charcoal can help. Chlorella is another really good one. Cilantro, parsley, those you can do dietarily. What else? We do so much. Glutathione's fantastic. NAC, so helping the liver. Glutathione's kind of the master detox antioxidant in the body. And those can be delivered either IV, so glutathione IV is fantastic. There aren't a lot of providers in the state that do it. Sean's office does, so.
We do it.
Okay, perfect, they do it too, good. Maybe we will at some point, we don't yet. And so let's see. There's so many different detox treatments out there. There are also these treatments called Picana drainage remedies, which are more a homeopathic approach. So I would say they're a lower force intervention. They just help to open up those detox pathways, whether it's the liver or kidneys or lymphatic system. Lymphatic massage, people can do it at home or do like dry skin brushing. I have some people who will do contrast hydrotherapy in the shower, so actually alternate hot and cold in their shower. So doing like 3 minutes hot, 30 seconds cold. And what that does is it just helps to tonify the vasculature. It helps to tonify the lymphatic system, get circulation going. So not a lot of people love that, but I find if somebody does it, they actually start to crave it a little bit. It's like eating bitter foods. Most people don't like it, but once they start doing it, it helps to stimulate digestion. They actually start to crave it. So diet, that could be. Yeah, I'll just stop there. Yeah, there's so much for detox.
Can I add just one little quick thing?
Absolutely.
So there was a study underway right now called My Lyme Data. If anybody here has had Lyme disease, knows anybody with Lyme disease, please participate in this study. It's a huge, big data study. We've got 12,000 plus participants now. And basically, it's trying to figure out what works, what helps people feel better, all kinds of stuff that they're looking at. The number 2 thing on that was sauna therapy. So sauna is anything that gets you sweating, right? Far infrared sauna is commonly used, but just a regular old sauna seems to work as well. I'm also a big fan of a really hot bathtub full of Epsom salts and baking soda. That gets you sweating a little bit, and the Epsom salts is good for various reasons. But sauna seems to be a big one in that My Lyme Data survey as well. Great for detoxification.
Something about sauna though is there's a certain amount that's good. Too much can be counterproductive, or it can really throw people deeper into a herx because it raises core body temperature, stimulates immune function. So it's a really fine balance with the sauna.
Work with your healthcare provider.
Yeah, exactly. Don't go do 45 minutes in a far infrared and just,
So one of the things that we hear a lot when people, they get their diagnosis, they start treatment, and they say, great, not only do I have Lyme and Babesia, now I'm dealing with mast cell, EBV, so on and so on. You want to touch on that, why sometimes those appear or are produced, or you want to talk about that because that comes up a lot.
Yeah. So it's not that the Lyme suddenly causes Epstein-Barr virus or EBV to appear, but because of how Lyme drags down on your system and really causes this immunosuppression activity, sometimes we will see viruses and other infectious organisms suddenly wake up again. So if you ever had mono when you're a teenager and you've been fine all these years, you could have mono again, have a EBV flare up, 40 years later, because the Lyme disease has really stressed your system. There have been over 60 infectious organisms associated with ear ticks so far that we know of. Many of them are viruses, so it's possible to catch some viruses from ear ticks. But other things that have been dormant in your system all these many years can wake up all over again. So that's why the treatment is holistic and complicated and has to be individualized.
And then some of the things that we hear, and I'm just throwing some stuff out there so you guys can, dispel all the myths and everything. We hear people are told from some of their primary care doctors that once you get it, you can't get it again. Because once you're treated, you build up an immunity. You want to touch on that one, Annette?
You looking at me?
Sure.
That's not true. I just had a mom ask me that this morning.
There you go.
It's definitely not true, and it's unfair and it's scary. But you can have Lyme, you can go successfully treated and be feeling great, and you can get it again.
Yeah.
So be careful.
Do you want to talk about some other things that you're seeing patients present with?
Absolutely. Yeah, so in addition to, viral infections can be a big piece of it, Epstein-Barr virus in particular, but HHV6, human herpes virus 6, cytomegalovirus, parvovirus, other bacterial infections that somebody may have had prior but can kind of lay dormant, inactive in the body, but can become active, like Mycoplasma pneumoniae, which can cause walking pneumonia. But people can be very asymptomatic of it, but it can cause chronic fatigue and pain. So there's a lot of other organisms. But mold and mycotoxin illness is a big piece that I think a lot of providers are also focusing on right now. Mold is rampant everywhere in the U.S., but particularly in areas like the Northeast where it's really humid, we get a lot of rain, a lot of snowfall, which melts, and then people have, old homes, so basements aren't necessarily, well protected from water. So mold and mycotoxin illness right now is something that I'm focusing on really heavily clinically, especially for patients who they look like they have Lyme and let's say Bartonella, they're getting improvement, but then they kind of hit a wall using all of those tools that I know to use. Often we'll kind of circle back around to mold and mycotoxins. There are, so mycotoxins are just toxins that molds produce. And the unfortunate part about it is you can have no smell, no musty smell, have no idea that you have water damage in your home, and it can be rampant with mold. And mycotoxins don't necessarily smell. So they can be circulating in the air, mold spores can be circulating in the home, and you really have no idea that it's happening. There are some good sort of screening home tests that you can do called an ERMI test, ERMI. It's Environmental Relative Moldiness Index. The lab that I go through is called mycometrics.com, and you can go on to their website. You can order a kit. There's two different types. One is like a wipe. It's like a rag that you wipe if you have hard surfaces in your home, like hardwood floors. If you have rugs or carpets, there's a vacuum attachment, so you can vacuum up kind of old dust looking for those mold spores. And then there's also two other tests that we'll do. One is a sinus swab, so actually using a nice long Q-tip, going a couple inches into the sinuses. Doesn't feel good if somebody's eyes water, you've gone far enough. If they don't water, you haven't gone far enough. If it's not uncomfortable, you didn't do it right. But that will actually show if fungi or mold species or marcons, which is a specific type of antibiotic-resistant bacteria, have actually colonized the nasal passages, and this does happen quite often. And so there are particular intranasal or intrasinus sprays. Coastal actually formulates some really good ones, so I end up calling most of my compounded medical nasal sprays to them. Clear, which is XLER, is a xylitol sinus spray that works well. Argentin 23 is a silver that can work. And then there's also a urine mycotoxin test that we often use, which is actually looking to see what your body's trying to detoxify with mycotoxins through the urine. And so there are all different types of mycotoxins, which are associated with specific species of mold. So the sort of worst case scenario is somebody has to remediate their home, and it's really expensive. Sometimes insurance covers it. If it doesn't, we sort of make do with what we can, sort of trying to minimize exposure as much as possible, using certain types of HEPA air purifiers, improving detoxification with binders. I talked about chlorella. I use one called Ultra Binder, which is great because it has activated charcoal, it has clays, it has aloe vera, it has silica, a whole bunch of different binders to try to bind up those mycotoxins so that you don't reabsorb them in the large intestine. Ultra Binder, it's a great name. It sort of nailed it on that one.
Is it a pill?
It's a powder, and it's like you mix it with water, and it's just deep and dark and doesn't taste like anything. Yeah, it's really benign, but you look at it and it's
You
just
just don't
dark.
look at it.
Yeah, just don't look at it. I would say that's the biggest thing that I'm focusing on at this point, in addition to sort of all the other stuff. Yeah.
Something else that's emerging in the Lyme-literate medical world is parasites. And so oftentimes when I've got a patient who's kind of been stuck, and we're treating and they're staying on a plateau and not really getting better or worse, I'll treat them for parasites using either pharmaceuticals or herbal protocols, and that gets them off of that plateau and really kind of gets them over the hump and gets them all the way better. So, this is actually quite a simple test to see if you have a parasite. So I want everybody to hold 2 fingers up like this. Hold 2 fingers up like this, okay? Put those fingers right next to your trachea, right there.
I don't know if I want to know.
Okay. Do you all feel a pulse? You have parasites. So every unit has some parasites in them. Whether those parasites are a problem or not is another issue, but oftentimes we'll treat empirically for parasites. And then heavy metals is the other big thing too that keeps people stuck, especially with neurological symptoms. So we'll look for the presence of lead or mercury or arsenic or other toxins that are kind of clogging up the works in their body and causing ongoing neurological damage.
So, AlphaGal. The red meat allergy has hit Maine. It's in the Midcoast. We've got about 8 cases of it now. And we're finding that more dietitians and trying to think what the other, the food allergists.
Allergists?
Yeah, the
Yeah,
allergists are the
allergists
ones
and
that are
allergists.
discovering it. Have any of you had any patients present with these? Yeah, and do you want to talk a little bit about that?
Sure. So AlphaGal is an allergy. It is basically there's a protein in the saliva of deer ticks, certain kinds of ticks. It's the star eye, the
Lone Star.
Lone Star tick. Sorry, the
Yep.
Lone Star tick. And there's a protein in its saliva that looks very similar to a protein found in a lot of red meat. And so your body's immune system can begin to have a reaction to this protein. And when you eat red meat, you can suddenly have this very dramatic allergic response, like an anaphylactic reaction. So hives, lips swell up, throat closes down, all that stuff. They can happen very suddenly, and it's highly variable. So some people with this AlphaGal allergy will have that response within minutes of eating red meat, sometimes not for several hours or a couple days afterwards. So it's kind of hard to nail it down sometimes. But we're seeing this emerge now in Maine. It's been kind of up and down the East Coast and in Texas. And so that's the AlphaGal allergy. So if you have those sudden anaphylactic reactions, then make sure you're thinking about that and that your healthcare provider works it up. There are tests to look for that AlphaGal antibody.
Yeah, testing and treatment, so you are not allergic to red meat for the rest of your life. That's the good thing. And I just want to piggyback on what Shawn mentioned about the red meat. They're also finding it with pork and with dairy and with eggs. So what the allergists are telling patients is if you suddenly have an allergic reaction to something that you've been eating all along, think about that and ask about that and get tested for it. It should be something that you're looking at. So the last thing I want to ask you guys, and then we'll open it up to folks afterwards, is what type of supports are you offering to your patients during the course of treatment with regards to pain management or just overall comfort? What type of things are you offering or suggesting to them as supports?
I'm a big proponent of CBD oil, medical marijuana. I used to work for Dr. Sulak for a few years, so I know a lot about medical marijuana. And that low-dose naltrexone are common things we're using in our practice. I know you guys probably are.
What was the second one?
Second one, CBD, medical marijuana, medical marijuana with THC, and then a low-dose naltrexone. Naltrexone, yes. So it's a compounded medication that was originally developed in much higher doses to block an opiate overdose, but it's been found that using it in almost like microdoses is able to bind to our receptors to get our body to make more endogenous endorphins, essentially. So for pain management, autoimmune things, sleep, a lot of things that patients with Lyme are dealing with, it can be very helpful.
What
Yeah,
about at Scarborough? What are you guys offering?
Definitely sort of double down on those two. I can't do medical marijuana cards, but CBD is a big one. The big thing with CBD, though, is a lot of products sort of out there in the world don't have in them what they say they do. They're not actually at the strength that they claim. So ensuring that if you find a product that has been third party or like lab tested for purity and for the actual strength of the CBD in there is really key. CBD can be quite expensive. That can be, I think, one of the downsides sometimes for people is the price associated with it. I think some of the IV therapies like IV Myers cocktail, IV glutathione can be really nice for managing pain, detoxification. Epsom salt baths, like Shawn mentioned, can be really nice. Massage can be nice if it's the right kind of massage. Deep tissue is often counterproductive because it can actually increase symptoms for some folks. The frequency-specific microcurrent that I mentioned that this new doc's going to be offering can actually be really helpful for pain. A lot of physiatrists will actually use this machine to address pain for folks, like fibromyalgia, chronic pain. It can be really helpful for. Oral anti-inflammatories sometimes are helpful, sometimes they're not. Don't use narcotics, can't and wouldn't probably if I could. Personal preference. I think that kind of covers it for me.
I would tack on acupuncture and acupressure. I'm a big fan of those modalities. They've been well studied for pain management, as well as medical hypnotherapy, also studied very highly for pain responses. I like the anti-inflammatories. There's a company here, Integrative Therapeutics, who does some good anti-inflammatory herbals as well, so I use them and some other companies too. That UVLRX machine that I mentioned before, that works on pain for sure. One of the wavelengths down-regulates or turns off inflammatory cytokine production, which means that you're basically nipping in the bud your body's inflammation response. So I've seen really good responses with that therapy for pain. Pain's a tough one with Lyme. It's damage, it's inflammation. I find that getting enough sleep often helps, and I don't think I've ever met a Lyme disease patient who's getting enough sleep. It's so challenging for patients to get enough sleep, so I'm really work on that. You wouldn't think about that. Hydration, none of us mentioned hydration. You gotta drink a gallon of water a day at least if you've got Lyme disease, and that helps with pain, that helps with flushing out the toxins, that helps with energy and everything. So that's a big one too.
You were talking about trying to manage pain. There's also the emotional component of it, and I know a lot of you guys talk about that and counsel patients with that because, there's a stigma that, we don't want to see a therapist, we don't want to see a counselor because they're going to tell us that we're crazy, but you got to put this stuff somewhere. And I know our families are not always equipped to hear us complain and gripe about the same thing over, or they just can't be there the way we need them to. So I know you've got some practitioners there that can address that. Do you want to talk about that?
Sure, yeah, we've got some Lyme-literate counselors in our practice. There are others around the state, and Paula's an excellent resource for figuring out who's local, who does counseling. So Lyme itself can cause depression and anxiety because of how it imbalances the serotonin and dopamine and GABA and other brain chemicals or neurotransmitters. So you're not depressed because you're sick or sick because you're depressed. It's kind of all wrapped up into one. We talk about that mind-body connection a lot. For me, it's all you. And so the Lyme causes this neuroinflammation, which leads to imbalances in the chemicals, and you feel down and depressed and sad. And it's not your fault. It's not a character flaw. It's not a choice you're making. It's a disease of the brain, and you've got to treat that disease.
Anybody else want to add anything else to it?
I with a lot of people I do have a lot of patients who are kind of ashamed of the psychiatric symptoms that they have because it's not them, and I do reassure them that this is not you, it's what the impact of the infection is having on your brain, and I think that helps people to kind of be a one step removed from their symptoms. In particular, like Bartonella, the rage and anger. Some people have significant problems with their significant others or kids, sort of flying off the handle, rages, punching walls, punching fridges, and then feel really, really guilty and ashamed about it. So helping people understand that this is not you, this is not who you've become. It's the effect of the illness on your brain and on your body. And even though it is tough to partners can't necessarily carry all of that emotional piece, but I think it's really critical to have partners on board and understanding with going through Lyme disease. I think some of the most trauma that I see in patients is in those people who don't have supportive partners and don't get it, who don't believe the illness. That's really crushing for people. So I really encourage most adults who come in, if they have a significant other, that their partners are there so they can actually hear firsthand versus hearing it from their partners, and they kind of question what their partner is telling them.
And on our website, we have the state of the support groups that we are aware of, not just the ones that we run, but the ones that we know of around the state. And I encourage people to try to get to those as often as you can, because there's nothing more therapeutic than sitting in a room full of people that are going through what you're going through, and you're sharing your frustration about how hard you've been working at your treatment. You just got your blood test back, and guess what? Your numbers didn't budge, or they budged a little bit, or something happened and your spouse didn't understand, or your boss can't understand your limitations. It's just something about being in a room full of people that understand, and we run several of them across Maine, and I learn things from people, and we also validate each other. I was so neurologically impaired, I don't even think I could be embarrassed for some of the stuff that I did, because I wasn't even aware of what I did. And it was only after the fact, when I went in remission, that my husband shared with me some of the stuff that I did. I mean, I had a Bart flare, if anybody has Bartonella, and I decided I was going to trash my kitchen. I threw glasses and plates and whatnot, and I shattered everything, and I woke up with him with his arms holding around me on the floor, and I just kind of looked around and I was like, what happened? I had no recollection of that memory. And he has shared that years later in the groups, and I say, well, geez, why didn't you tell me about it? And he said, because I knew that it was the disease, it wasn't you. And I don't want you to feel bad about something that you couldn't control. And that has stayed with me, and I share that in our support groups. You should never feel bad about something that you cannot control. And I will say that to you every single day, and I will text it to you, and I will call you at home, and I will email you if I have to 100 times, and I will remind you that you should never, ever feel ashamed about something that you cannot control. Any more than a cancer patient should be ashamed for going bald because their hair fell out. If you have a neurological infection, you cannot control your mood swings, you cannot control your rages. The doctors can help with medication, we can help with support, we can kind of give you an outlet for that, but you should never be ashamed about your good days and your bad days. It's just something that you're going through, and hopefully getting you connected to the right doctor, finding the right recipe for repair will get you back on a path where you have more good days than bad. So we're going to open it up now for questions. I would ask that you just raise your hand so we can call on you, and stand up if you don't mind, if it's not too physically hard, and speak loud so everybody can hear you. And then whoever wants to answer it, if you wouldn't mind just repeating the question back. Yes, ma'am.
I just have a very simple, quick question. You mentioned your support groups here in Maine.
Yeah.
Do you have on your website information about support groups like in Massachusetts? I have a very good friend whose daughter has been battling Lyme for 3 or 4 years, and she's going off to college.
Right.
And so she's trying to figure out how to get her connected.
We can do that. Okay. Yeah, we're networked with groups all around the U.S. So if we have a lot of visitors, believe it or not, come to Maine, and they get take home little ticks or whatever, and so then they need us to get them connected to those local resources. So yes, we can get them connected to that.
Great.
Yep. Yep.
One good website is LymeDisease.org. It's the Lyme Disease Association. They've got kind of lists of local practitioners, and you can search by zip code and whatnot.
Yeah, they've figured out, I think, practitioners, but it's that you're right.
Yeah.
Support groups.
The support groups. Yeah.
Yeah.
Yep.
Thank
Yep.
you.
And your name is
My name? Oh, Paula Jackson Jones.
Paula Jackson Jones.
Yep.
And could you all give me and us your names and your phone numbers? Will you have?
We've got all that information. We can share that with you.
Oh,
Yep.
it is.
Yep.
And then I do want to ask about Medicare. Does anybody take Medicare?
There are certain providers that do, and there are some that don't.
Do any of you take Medicare?
Yeah.
No, no.
I can't,
no.
yeah, no.
Yep.
Dr. Mahoney does, though.
Yeah.
Absolutely.
There are
Yeah.
different doctors that do, and we can get that information to you as well. One of the things we as a group caution is publicly using the names of the doctors that are out there. Before certain laws went into place, there were doctors that were coming under attack by the medical bureau for the way that they practice, for the way that they treat. And so it's not something that doctors really need to be ashamed of, but there are other, believe it or not, there's other doctors out there that just want to cause trouble for the doctors that want to be there to help us. So a lot of times we'll see names be, going around on Facebook or whatnot, and I just kind of cringe a little bit because next thing you know, you see that doctor come in the crosshairs. And I think the patients are just trying to help each other with that, but there are different paths and different avenues that you can go to get names of providers, good providers, and find out who's got a 9-month waiting list or who's taking new patients, who takes Maine care, who takes Medicare, and kind of get in there versus making a bazillion different calls and possibly putting a bullseye on the back of a provider. So we can help with that. Yes?
Well, that leads me to how disheartening it was when I was first treated for Lyme in 2009, 2010, that there was such a war going on.
Still is.
On the medical profession. And I'm wondering, what is it like now? How far apart are the CDC guidelines with what Iliad is recommending? Could you speak to that, please?
The CDC has actually taken the treatment guidelines down. I know the Maine CDC does not put any treatment guidelines on there. They're not endorsing any one particular one because their guidelines are strictly for surveillance purposes. They are not for clinical diagnosis. So when ILADS and the IDSA started going war to war with each other, and then the federal tick-borne disease working group, which I was part of the subcommittee on last year, when all of that came out and the recommendations came out, the Maine CDC distanced themselves from any of that. They said, we're just here for surveillance purposes only, even though, I talk to a lot of doctors that say, oh, I followed the Maine CDC guidelines, and I'm like, really, how's that working out for you? Because there's no guidelines out there. So that kind of tells us where they are. But there's, every doctor has to kind of decide what they believe in, because there's so many different ideas and so many different sciences out there. Some are new, some are old, some are controversial, some are not. Each doctor has to decide for themselves what they believe in and how they're going to treat their patients going forward. And I believe that that's how it should be for every doctor. I don't think that there should be a big national conglomerate that's going to dictate that everybody has to do the same thing, because that equates to what Shawn said at the beginning. We all have to fit into a certain box. And once you get into that box, we all get the same dosage. And when we're done, that's it. And if half of us respond, great. If the other half don't, those that don't, where are we left? So there's, we need to get patients that need to be connected with these providers. We need to get them more in touch with these providers. Jacob mentioned, you're not usually the first initial go-to. For me, it was Dr. 24, 25, 26 that figured it out. When I talk to people, they've been through the mill. They've been to a dozen or more, half a dozen, 2 dozen doctors. They've had many misdiagnoses, and they're finally exhausted, and they're saying, why can't people figure out what's wrong with me? I have all of these different symptoms. I have all these different labels. Why can't the doctors figure out what's wrong with me? We've got doctors that are at odds with each other over a particular diagnosis. So that puts the patient in a very awkward position. Who do I listen to? Do I listen to my primary that I've known for 20-something years? Or do I listen to this doctor over here that I just met for the first time?
And just a second question related to all this. Is there any progress being made towards a vaccine?
Well, you
New
want to talk
information
on that
on
one?
Sure. So there was a Lyme vaccine that was available in the 90s. It didn't work very well and it didn't sell very well, so the company stopped making it. They're working on another vaccine now. It's in very, very initial stages of treatment or testing, I should say. So it's not widely available. So no vaccine currently, but the ultimate goal, of course, would be to nip Lyme in the bud and treat it like any other illness and get a vaccine out there for it. So we don't have a vaccine yet for it.
Yeah, the FDA is trying to fast track a vaccine that is coming out of France. The problem is the Federal Tick-borne Disease Working Group has identified that they're using the same recipe that they used back in the 90s that they pulled because it was doing more harm than good. So all that subcommittee asked was, can you please let us know why it didn't work the first time? And they keep skimming over that. They won't publicly disclose why it failed the first time, only that it failed. And all we know is that the first one came out that failed, the second one's being fast-tracked. And so that's all we know at this point. A lot of times we get asked why the vaccines for animals can't be given to humans, and the simple answer is we don't even have the same biologies. Veterinarians know so much more about tick-borne disease. They see it in a dog, they give them their doxy, they respond to it. It's apples and oranges. Our biologies are not even similar, so even the vaccines that they give the dogs wouldn't work on us. So,
Thank you
yes.
for all your work.
Yep.
So I just wanted to ask you a quick question about prevention, because, we just talked a lot about treatment.
Yep.
I know
Yep.
the Cedarside company is no longer being able, because of some, business deal that they can't import into Maine right now.
Yep.
So I'm
It's a
wondering what recommendations.
pesticide block. Yep.
You're making because of the pesticide laws.
Well,
Yeah.
yeah, that
Wanna
came
repeat
up
the
this
question, too?
morning. Huh?
Repeat the question.
Yeah, she was talking about the cedar side, talking about prevention. So we get asked all the time, what is the state doing with, as a whole, what is the state of Maine doing? And the answer is not much. They don't have funding for it. They want to do things, but they just don't have the funding for it. So it comes down to personal preference. They are doing a lot of different things. Unfortunately, what works in one state is not cleared by the pesticide group, so it has to be regulated by different states. And every time they try to bring something in, like the spraying that they did down in Florida, it's not allowed in the state of Maine. So we have a slip over on our table over there, the 5 points of prevention. Basically, it all goes back to you, what you want to do, what works for you and your family. Everything from, repellents on your skin, to treating your clothing, to buying clothing that's, infused with permethrin, to treating your pets, to buying the vests that are infused, to the products that you clean your house with, and then pest control companies or do it yourself for your yard. There's those 5 points. We have the handouts over on the table. People ask me all the time, what's the best? And I tell them whatever works for you. We talk to hunters all the time. We talk to outdoorsmen. We talk to sportsmen. They love their DEET. They love their off. They love their bends. They love the really strong, smelly chemical stuff. Then I talk to the moms with their children, and they want something a little more natural and organic. The difference with that is it's effective. It just doesn't last as long, so it'll wear off. Same thing with yard. What do you do for your yard? I highly recommend you contact a pest control company. They have options from chemical to natural and organic. For my yard, we actually do it ourselves. We put down granules. I also have 3 dogs. We've been doing it for 5 years. I can personally attest, they hand out on my table, I've been practicing it faithfully for 5 years. No ticks. None. Not on my dogs, not on me, not on my husband. My husband did get a tick on him when he went off our lawn. He went into the woods to look at an old truck in the woods. He went off our lawn into the woods, came out with a tick. So their ticks are out, they're everywhere. Huh?
Give him a shock collar.
I should. It works. It works for the dogs. So, wearing your clothing or treating your clothing, putting something that works for you on your skin is going to protect you no matter where you go. And then obviously how you treat your home and your yard. So there's so many different things. There is no right or wrong answer. And you can actually go to the state of Maine and find a qualified pest control company. They have to pass rigorous testing. They have to know all these laws. They have to know all the different things. That's why regulation is state specific. They will talk about the essential oils, the different things. There's a whole great big huge, it's called Got Pests. It's on the Maine.gov site. It goes all into everything from chemicals to natural and organic. It spells it all out for you. What I like is you have choices. I don't want some government agency telling me I have to do this one thing because it works, because chances are I'm that 1% it's not going to work for. So I want to know that I have options and plenty of them. So
Single most thing you can all do, which is absolutely free, is every single day check every inch. Where the sun don't shine is where the ticks like to go. So get used to your own bodies and just feel everywhere in your body, every inch. The deer ticks are as small as a poppy seed, so you're feeling for a poppy seed on your body. Find that seed. When they're engorged with blood, they can be as small as a sesame seed. So they're teeny tiny.
Yeah.
So check yourself, check your partner, make it fun, but do it every day. And that's the best you can do.
Yes.
I have a question.
Sure.
It doesn't seem like it was very long ago that the majority of primary care did not even accept the fact there was Lyme problem in the state of Maine. Is that changing? Sadly enough, it's not.
So the question is, has it changed with primary care doctors accepting that we have a problem?
Correct.
Okay. Well, from where I sit, the answer is no. They acknowledge that we have a tick problem. They think it's easy to treat. I'm hearing almost daily patients that go in, have a tick removed. They're either given a shot or 2 pills and sent out the door. The new tick lab up in University of Maine, Orono, the Cooperative Extension Tick Lab now can test for the presence of pathogens for $15. So if you do remove a tick, save it. Do not throw it away. I had that conversation with the Maine CDC this morning because people are going to the ERs. The ticks are being removed and discarded. People are going to the primary, ticks are being removed and discarded. They now just took away any option you had to figure out what you've been exposed to. Taking a tick off you does not mean that you've been exposed, but if you become symptomatic, it gives you a really good place to start, especially if the lab says that the tick that came off of you had Babesia, and suddenly you have Babesia symptoms. It's a lot easier to figure out what you have, what to test for, how to treat, as opposed to going in blindly with these symptoms to a doctor that doesn't understand tick-borne disease. They tell you you've got the flu and they send you home.
Do you have info on how to remove a tick safely on your?
It's on our website. Yep.
So,
Yep.
can I follow that up with?
Go ahead.
What is being done in the state of Maine to educate, in my mind, the smartest people around here to treat us
Right.
for Lyme?
Right.
Because there's so much negativity about it. You don't have Lyme. We don't have a Lyme problem.
Right.
But we do.
Right.
So,
Every year I call the Maine Academy of Family Practitioners to ask if I can give a lecture to their state assembly. No answer.
Yeah.
Every year,
Really?
no answer. Yeah.
Yeah.
It's astounding to me that we're not educating ourselves as physicians.
Right.
Maine is close to the #1 state in the nation for incidence rates of new cases of Lyme disease. We're in the red zone, like I mentioned. And yet, like,
Yeah.
why don't our doctors know about this? So I
So
don't
it's
have an
usually
answer.
doctors like Shawn and Annette and Jacob, they have to take it upon themselves to stay in the know, going to conferences and whatnot. The Maine CDC was given $18,000 last year
For Lyme?
for education. $18,000. So they held what's called Train the Trainer sessions, and they were looking at teachers and school nurses and whatnot to come out, and they were going to teach these lay people basically everything that we know up to this point, and then they were going to be the go-to people for their areas. And I have followed up with them, and
Good.
yeah. So you have to rely on, advocacy groups. You have to rely on the internet, the groups on the internet like the LDA and the LDO. And also, we know that a lot of the Lyme providers and their centers are also educating. They're doing, I know you have, you go around and you do some education, you host nights or events, stuff like what Coastal is doing. I mean, it's just people that are taking an interest in furthering the education. My group, we travel all around the state and do free educational and prevention talks year round. It's constant. It is always constant. We do workshops. We've done mental health workshops. We've done pediatric workshops. We've done geriatric workshops where we bring in those specialists to train the main pediatricians or the main, mental health providers, and then use them as a resource. All we can do is just put that information out there.
Right.
It's like trying to teach people, you tell them about prevention, you tell them about repellent, and then your neighbor will say, oh, I got a tick on me. And you say, well, weren't you wearing your bug spray? You're like, well, no. But we all know there's a tick problem. We all know we have to do it. But most of the time when people say to me, I had a tick on me, I don't want to ask if they wore a bug spray because chances are they were not. But it's just knowing that information is out there and it's accessible for people. And then also, having a plenitude group of providers. People will reach out and they say, I want to see a naturopathic doctor. Okay, we've got a group. I want to see a chiropractor. I want to see an integrative provider. I want to see somebody that does bio or holistic homeopathy. People will reach out and say, this is my lifestyle. Is there anybody within my lifestyle that is knowledgeable about Lyme and tick-borne disease? And that's how that group has grown from there. So you don't have to come outside what you're comfortable or your preferred medical journey, that type of thing, to be treated for this. Yes?
Given that ticks are ubiquitous in the summer in Maine, and given that it's easiest to treat in its early phases, does that argue for a short, sharp antibiotic prophylactic treatment through the tick months?
I would say the risks outweigh the benefits in that case. So how long to take the antibiotics for you stay? By the way, you can get Lyme all 12 months of the year in Maine. I've had people come in January with a bullseye rash. So more often you're outside in the summer, and the ticks are more active in the summer. So that's always a question that I have for myself too. Let's say you're an outdoors person or a hunter or whatever, you're getting bit by ticks all the time. Do you take 3 weeks of doxycycline every time you get bit by a tick?
Right.
I don't have a good answer for that. I think sending the tick off for testing makes a lot of sense. And if the tick is negative, you probably don't need to be on antibiotics in that case. But I don't have a real good answer. There's certainly no evidence-based guidelines that would indicate you should be on antibiotics for certain months of the year that I've seen, at least. Have you guys seen anything like that at all?
No. And something about tick testing. So the tick testing is actually very accurate. It's far more accurate than the human testing, because basically what they're taking the entire tick, essentially grinding it up and then looking for the DNA, the building blocks of the different infections. So they have, I think it's like a 95+% accuracy, sensitivity, 98% sensitivity, specificity. So you have a pretty good chance that test is going to be accurate, so you can trust it. Whereas with the human testing, as Shawn said, could be 40 to 90%, which is a broad range, probably closer to 40% accurate. So you can really trust. The cooperative extension, do you know what they test for?
They're testing for 3 different strains of Lyme, 2 different strains of Babesia, and a strain of, there you go.
Anaplasma or
and the anaplasma,
Oh, good.
They're going to be
Good.
expanding into a few more. They're going to be looking at Rocky Mountain spotted fever, Bartonella, and Powassan by next year.
By next year. There's another lab that you can't, it's called ticknology.com. I stumbled upon it in the past couple months.
Heather,
They're good and they're cheap. It's like $25. You can rush it, like a 24-hour, 48-hour rush testing for $45. But I think they test a little bit more expansively or more broadly than the cooperative extension does at this point. So that's another option.
And Tick Report down in, the University of Mass at Amherst, they actually are looking for regional diseases. So when you say that you live in Maine, they're actually looking for every known tick-borne disease to the Northeast corridor. So you're actually going to get back anything from 8 to 15 different diseases that are known for this area. That costs about $50. Eventually, I think our tick lab in Maine will get to that. The lab in Maine is actually mirrored after the one down in University of Mass. They came down there, they set them up, so they're working together. It's just it's slow going because they don't have enough manpower in there to look at everything coming in. So, yes?
I'd like to thank you all for being so well informed and digging into these situations where there isn't an easy answer, it's complicated. You put out good information for us. I'm right now in a situation with this test. Even taking that in hand when it tested for both, I can't name the names, for one and the other, or whatever. My doctor was, you have to advocate for yourself.
Absolutely.
And even if, I know he doesn't agree with me because it's only 4%, well, I don't want to be one of that 4%.
Right.
And to say, this is what I would like. And so what he said he's prescribing for me is peace of mind. Thank you very much, I'll take it.
There you
And
go.
I'll take that 21 days of that awful stuff. And thank you for telling me about the short rounds, because he didn't.
Oh, wow.
Right. You had a question?
Can I say something about that? We haven't actually talked much about how long it takes for the infections to be transmitted by the tick. So co-infections, it's accepted by the CDC that those could be transmitted in minutes. That's stated on their website. For Lyme,
what?
So the other
It's more than
infections
Lyme,
that
yeah.
Annette mentioned, so Babesia,
Yeah.
Bartonella,
Yeah.
Anaplasma. Well, CDC doesn't agree that ticks carry Bartonella, but they do. Babesia, Bartonella, Anaplasma, Ehrlichia, tick-borne relapsing fever can be transmitted very rapidly. Same is true for Lyme. CDC doesn't accept that, but the spirochetal bacteria are found in the saliva of deer ticks. So you can imagine a tick bites you, that saliva is going to essentially into your bloodstream. It doesn't have to actually regurgitate the contents of its gut for Lyme to enter into your system. So it can be rapid. So if a doc says, well, it hasn't been 48 hours, that's irrelevant.
But the 21 days should take care of it, right, if it did transmit.
Hopefully.
Catch it early enough.
If you're
Yeah.
still symptomatic for 21 days, then you might need a longer treatment.
Yeah.
You had a question over here. Go ahead.
So I have a 6-year-old that I refuse to not let him go play in the woods. So
Good.
I pull ticks off of him that bite him. And should I test every single one of those ticks that I pull off of him that have bitten him?
If they are embedded, then in an ideal world, yes. But what a hassle, and how expensive is that?
You want to know what's living in your backyard.
Yeah.
You want to know what's living in your backyard. So
Well,
maybe you
he
don't
goes
treat.
to Waldorf school and we go
Right,
everywhere. And I'm
yeah.
gonna just keep
Right.
him in my
Right.
treated yard.
Sure.
I would find a really good repellent
Yeah.
for him. And there are some that are specific for children, and definitely treat the clothing, because I agree. I mean, you don't want to keep the kids inside any more than you want to keep the animals inside. You know, and I always want to encourage, like even our hunters say they stopped hunting, the fishermen stopped fishing. It's like, no, we need to get back out there and enjoy things. I gardened before I got sick. I garden again now. You know, I treat my clothing, I treat my skin. When you do it the right way, you go out there, you're not going to have those tick encounters. When you stop having those tick encounters, you stop being afraid of the ticks. When you stop seeing them everywhere you go, that fear factor starts to come down, and you get back to enjoying what you're doing outside and not picking off ticks and wondering, okay, now what am I looking for? You know, because it's hard, especially when they're little and they start having behavioral issues, and you think, oh, it's just, you know, the terrible 3s, terrible 4s, terrible 5s. But that's how it presents with children. It's all behavioral, you know, and so you just don't know. And we hear all the time people that'll say, we don't treat children. We don't treat children for tick-borne disease. And I just cringe, and I'm like, okay, let's find you a Lyme-literate pediatrician, because you treat everybody. You treat everybody, you know.
Lindy, you have something to add over here?
Yep.
Yeah, I take care of like mostly pediatrics and
Yep.
moms. I usually recommend like if you get prometheum, and you could look this up online, or I can
The
talk to you
permethrin,
later,
yep.
you just make plastic bags and keep their boots, a certain hat and a jacket, and then the kids just get used to when they're being
Yep.
outside,
Mhm.
you know, to put this stuff on,
Yep.
because to put it on their skin is nearly impossible, and to pick it off is impossible.
One
Right.
chemical-free option that's out there is
Yes.
called a zero bug zone
Yep.
tag. It's a little plastic card, looks like a credit card, has a magnetic strip on it, and that repels mosquitoes and ticks and chiggers.
Yep.
It's a kind of a hassle because you got to wear it on your body all the time. So you put it around a little cord, like a little necklace or something, put it in their pocket. So little kids may or may not be able to do that. You can get them online, you can get them at our office as well, you can get them around. But they make certain versions for dogs, cats, horses, and humans.
Right.
And they work pretty well. The University of Texas did a study on these for mosquito bites, and it really reduced the severity by like 94% or something.
Yeah.
It's called zero bug zone tags, and no chemicals involved with that.
Is anybody making any kind of, I mean, I went and borrowed.
We still have another question. Hold on, we'll
Oh, yeah.
get that in a second.
Just
Go ahead.
wanted to ask, you said if it's embedded, how do I, like if it's bitten him and
Uh-huh.
I can't wipe it off with my hand,
It's
does that
embedded.
mean
It's
it's
embedded,
embedded?
yeah,
Okay.
Exactly.
yeah,
All right, so I can decide, but test that, test any
yeah.
potentially.
And
one
proper
that's-
removal is on our website, so you can see how to remove it, and then you can go ahead and get it tested and just see what they've been exposed to. You know, I don't like putting chemicals on my skin. I use the lemon eucalyptus oil. It smells really nice. No ticks. Just wash it off every night. Yes. And the ticks do not need to be alive. They don't even need to be in one piece. I spoke with Griffin Dill, who runs the lab up there, and he said the oldest tick they've tested was about 5 years old, and it showed up in pieces. So they can still see it, because it's going to go through the blender anyways at that point. Yes.
So we're talking about ticks, but I've also heard that mosquitoes, because they bite us if we have Lyme, or they bite deer that have Lyme, can transmit things too.
Yes.
There's a test out
Yeah.
of Europe that was just published, I think, in February or March, that showed a possible potential transmission for Borrelia, for Lyme disease. And so we don't know the answer yet. And I also have questions around sexual transmission as well. And so again, there have been some data indicating that they found some DNA particles in tears, in various bodily secretions. The big question is, are these live bacteria, or are they just pieces of DNA that kind of broke off from dead things? So we don't know those answers yet. This is like I said, tip of the iceberg with Lyme. The more we know, the more we don't know. So we don't know if mosquitoes can transmit Lyme disease. We don't know if you can sexually transmit Lyme disease. My sense is if it were easy, then we would all have Lyme disease, right? We'd all get better than mosquitoes. So it may be possible, but probably not very easy.
Did we have any more questions?
Well, how is it in Rhode Island? They have to have, all primary care have to have a course in Lyme disease. How can we get that moving in Maine?
Speak to your politicians.
That's what I was going to say. We all need to contact our...
There's actually a movement going right now with Senator Collins. It's come upon her radar screen, and they're looking at Maine being a test site because we meet all the different demographics that are needed for different testing and whatnot. So hopefully, it all comes down to money. You have to have the funding there. But there is a bill that they're looking at for 2020 that might possibly have extra funding. If Maine becomes a test site, I think we're going to see a lot of education. We're going to see a lot of information freely flowing and kind of pushed down on us as they try to figure out what works best and, you know, what doesn't work or whatnot. But
we really need our first line of defense, which is our primary care, who everybody trots off to. And, you know, you get rejected there, or you get some kind of, you know, brush off. And then you're down the rabbit hole. So, you know, they need to be informed.
And we're trying, but again, there is no law that says a doctor has to do a certain thing. There are laws to protect doctors who want to do certain things, but there's nothing to enforce a doctor that says you have to do this.
No, but hopefully if they're educated and they care about being a doctor, they would care about their patient.
And that's where this woman said we have to step up and advocate on our own. Correct.
He listened to me. He doesn't necessarily agree with me, but I may send him some information.
Well, my doctor got mad and slammed his hand on the table and said, "Who's the doctor in the room?" And I went, "Oh, great, I'm screwed now. Even he doesn't know." So if he doesn't know, I don't know. So, you know, you gotta laugh or cry or scream or whatever, you know. Yes.
Well, you commented on this is a red zone, and I'm just wondering about other red zones in the nation and whether people are coordinating questions or research and sharing. Is there any sharing going on? What are the other hot red zones?
The whole East Coast.
East Coast and Midwest are the two biggest spots. East Coast and Midwest.
Northern Midwest, like Minnesota, Wisconsin in particular, are very bad. West Coast is becoming a hot spot. California, there actually are quite a few cases of Lyme disease. Some in the Northwest, but California,
One of the things, you said, are we sharing information? One of the things we're seeing the spread of is legislation. And as soon as one state passes something, we start piggybacking on and we grab that and we start grabbing. When Maine started passing the legislation, and I've got a list on my table of all the laws in Maine that pertain to Lyme legislation, every time we went before the committee or, you know, to pass something into law, we had every other state behind us showing them all these other states had it. We were the last state to have a law that protected doctors that wanted to treat Lyme and tick-borne disease long-term. We were the last New England state. And we kind of shamed our politicians by that. That's what kind of pushed it in there, and the governor sat back and didn't do anything, just kind of let it slide into law. Didn't want to support it, but didn't want to stand against it either. So what we're finding is the advocates stepping up, talking to your politicians. We start seeing this wave build up, and as every state starts to pass different laws, we're seeing it all over the place. Pennsylvania, Iowa, Illinois, they're all popping up now, and they're just supporting each other and getting things moved, and it's going to be a patient movement is what it's going to turn out to be.
I have a follow-up question. I read somewhere that there's more tick-borne diseases, infections that have come up in Maine and in this area. Is that true, number one? And then number two, is that happening all over the place?
The ones that we know of right now, again, I keep sending you over to my table. They're listed over on the table. Those are the ones we know about. I'm sure there's a bunch out there that we don't know about. The Maine CDC just found out this morning of the first case of heartland. It was in like a 14-year-old sheep down in New Jersey. And then they just found out this past week that a New York patient tested positive for the heartland virus. So knowing that it's somewhere in the northeast corridor, they're on alert to see if it shows up this way, especially this time of year with visitors. So there's a lot of things on the radar screen. They're not publicly talking about it because we don't know that it's here. Just because you test positive here, they're going to ask you, where did you travel? A lot of the things that they're showing up on the radar, people actually traveled in from out of state. So it's not necessarily here, but it came in on a visitor. So they're aware of different things, but there's nothing out there right now, I would tell you.
You might be thinking of Rocky Mountain spotted fever, which, as the name implies, came from the Rocky Mountains originally. They are finding it in ticks in southern Maine now, which is relatively new. So that might be the one you've heard about.
Yeah.
And tick-borne relapsing fever is relatively new as well. Yeah.
She's got a question over here. Yeah, we'll take one more question and then we're gonna just kind of spread it up. You guys can come up and talk to everybody. Yep.
My daughter's in Florida. She has Lyme. She's
Yep.
in college.
Yep.
And they've never even heard of Lyme. They have no idea what it is, and she needs some combination.
Yep.
So, is there just like a quick source that we could say, like, what would be the
Yep.
best way that I could educate the schools?
I'll get you in touch with the Florida Lyme organization down there. They've got lots of doctors that are up to speed on all of this, and they can get her some local supports down there. Yep. Yep.
So
Okay.
I want to thank everybody on
Yep.
the panel. They've given their time for us and really, really appreciate it. So thank you so much.